Welcome to a presentation on taking the pulse of palliative care. My name is Jane Barton. I'm an educational consultant with Cardinal LLC, and it is my delight to be representing the Life Quality Institute today. Over the course of our presentation, we are going to be talking about a philosophy as well as a model, an approach to health care that will benefit families and individuals who are challenged by a serious, advanced, or terminal illness. Particularly in the United States, death is the enemy. And our society is incredibly death averse, meaning that we are scared to death to even talk about our mortality, the fact that we are finite beings. And because of this, our fear often paralyzes us from looking at the ultimate reality. And we choose not to talk about advance directives. We choose not to sit down with our families and to discuss, what if this were to happen? And because of this, we often have families in crisis. When something does happen, what are we to do? What did Mom really want? And having served as a hospice chaplain, I have seen families huddled in the halls of hospitals having these conversations and so overwhelmed and wishing they had talked to their loved one beforehand. Now, a good way to view this approach to care is to remember that palliative care addresses the gaps in end-of-life care. And GAPS is an acronym that relates to this distinction. G stands for goals of care. Now, these are not mandated to an individual. Instead, this is a collaborative discussion with the patient and the family. And the question will revolve around, what are your goals? What would you like to achieve? What are your concerns? And the palliative care team will listen to what it is you want and what you need. And then they will work to help you achieve those goals. A stands for advance directives. It is critically important in our society today to have papers in place, a healthcare agent designated. Identify what medical interventions you do or don't want at the end of your life. And it's not only important to have the papers, you must have the conversation with your family. Too often we can misinterpret what people have written down. We need the opportunity to talk about things, to chew them over, to debate, to discuss, maybe even to argue. But in the end, to understand what it is your loved one wants. Thirdly, the P stands for psychosocial spiritual support. Again, this goes to the recognition that illness is more than a physical challenge. It will challenge your entire family system. It challenges your foundational beliefs. How do you understand illness? What is the meaning of this disease? And if the doctors and the nurses are not able to address many of those concerns, then the chaplains and the social workers will come in for those discussions. S stands for symptom management. Hospice and palliative care professionals have always been known to be experts in symptom management. Now, this sounds so ordinary and so common, and yet, having taught in many medical schools and nursing facilities, I have realized and I have learned from medical students that they have limited training on pain management. They are not experts in this field. So this is certainly a need that is filled by palliative care.